Good morning, Professor. My name is Kulpreet Kaur. Today I'm going to discuss about a good presentation topic is medication error among nurses. We have 4 members in the group: Nishima, myself, Jaspreet, and Harmandeep. I'm going to discuss about why we choose a topic, why it is a Canadian healthcare issue, and what are the solutions to be done as a nurse leader. First one is introduction. Medication errors continue to be a great concern in Canada and healthcare. The problem of nurse making mistake in medication administration persists despite the training and the protocols, resulting in possible harm to the patient. There is an ongoing challenge of medication errors resulting from hospital as far as the patient care quality and the safety is concerned in Canada. In reference to a health report filtered by Statistic Canada, roughly one-fifth, that means 19% of the hospital-employed nurses reported that over the year medication errors affecting patients who were in their care had occurred periodically. Now, why it is a Canadian issue? Medication error poses a great risk to the patient's safety. Hospital wards frequently make medication errors which significantly lower the standard of treatment. Medication errors account for the one-fourth of medication error events. Then, medication errors cause thousands of deaths and increase the annual cost burden in Canada. Furthermore, medication error impairs the effectiveness of the healthcare system by lengthening and increasing the expense of the hospital stay for the patient. Last one is medication mistakes account for 25 to 63% of reported cases according to the survey. Now, I'm going to discuss about the solution. As a nurse leader, we propose a multifaceted approach that including first one is to adopt the electronic health records and second one is computerized physician order entry. Next one is implementing the barcode administration registration, and next one is standardized medication labeling and dispensing practices. Last and the least is educating nurses on the high alert medication and the safety practice. Thank you, Professor.
Hello, my name is Harmandeep Kaur and I'm gonna continue with the evaluated outcome of solution with the qualitative data and quantitative data. In quantitative data, first one, I'm gonna talk about the barcoding technology implementation. This error decreased by 43.5% and the dispensing and labeling practices decreased by 70%. Next one is nurse education on high alert medication error decreased by 25%. And in qualitative data, there is a improved workflow, there is an increased accountability, enhanced confidence, fostering a culture of safety, as well enhanced collaboration with the team members. Now I'm going to talk about some barriers and solution in medication errors. There is some barrier that includes the cost of implementing barcoding medication administration technology. And the second one is staff resistance to changing established practices. In this, resistance from staff who are comfortable with the existing method can hinder adoption. Now I'm going to talk about some solution. It includes the cost benefit analysis and the staff involvement and ownership. In this, we include the staff, especially the nurses, in implementation and planning process. By engaging the staff, it will make a better decision and we take a good decision making process, and we know about the new technologies. Thank you.
Hi everyone, my name is Nishima. I'm continuing with the impact that will happen after all these changes. And on the nurses, reduced error will help them to decrease the workload and stress among the nurses, which will help them to increase their productivity and the patient satisfaction, which will subsequently also result in their high morale and productivity of the organization. And for the leadership, by demonstrating a commitment to provide patient safety care through their initiatives and by reducing the errors, it will also increase leadership credibility and showcase the organization's dedication towards the high quality care for the patients. And with the patient family, if family care members, if the reduction in the errors are maintained, therefore the risk for the harm will be subsequently reduced, which will create a strong connection and build a trust between the patient with the family and with the staff members. Now I will be continuing with the next sustainability plan. In this, the first one is to secure the ongoing funding to establish a dedicated budget for the barcoding technology for the maintenance of the staff training. Another one is integrating the medication safety trainings. This will ensure that all nursing all incoming staff are adequately trained while providing care with the barcode technology and its importance in the medication safety protocols. And the last one is to conduct regular audit. By implementing a systematic process for conducting regular audits will help to increase the effectiveness of barcoding technology usage and to identify any areas of improvement. Thank you so much.
My name is Jaspreet Kaur, and today I am going to tell you about what all are the nursing theory and the leadership style that we are using in reducing the medication error in a Canadian hospital. So basically, a transformation leadership style is used in this reducing the medication error, because it embraces the staff so that the safety of the patient is maintained. And further, for the nursing theory, a system theory is used. Basically, it provides a framework that how to manage and how to organize the interventions that we are using for reducing the medication error in a Canadian hospitals that are basically done by a nursing staff accidentally. And next one is the resources that we are going to use for sustain that change. So basically there are 3 different resources that we are going to suggest for using. The first one is having enough financial support for implementing the different kind of technologies, and another one is conducting sessions for the employees in an organization so that they can up to date with all our the different changes and they can use it in their practice as well. And the last one is having enough support from the administration from the hospital, as it play a very major role. And at last, this is all about all the leadership style and the nursing theory along with the resources that we are going to use for sustain that change. As the medication error in the Canadian hospitals that are doing by the nurses is very manifested. By implementing such kind of interventions, these can be reduced and the quality of the patient health is maintained and their well-being is prioritized by the healthcare team staff. And at the last, these all are the references that we used for this topic, and this is all about our presentation. Thank you.